Welcome to one more episode of the Human AI podcast. I'm your host, I'm with ChatGPT, and today we're talking about a slightly more relaxed topic, very important, obviously. We're talking about disease and lifestyle factors and their intersection. I'm just going to check the audio as always, and if that's good, then we're just going to kick things off.
Sounds like a plan. It's great to explore how lifestyle factors can influence disease. I'm ready when you are.
Alrighty, so let's kick it off. Nice and relaxed topic. It's the middle of the night, by the way, guys. It's midnight, so yeah, kind of a late night episode for us today. ChatGPT, explain to us what are the most important lifestyle factors that we have to make sure we're aware of as patients. Doctors have to be aware of them, so both perspectives. In order to have a healthy heart, to have healthy lungs,
Sure thing. For a healthy heart and lungs, some key lifestyle factors include maintaining a balanced diet with plenty of fruits, vegetables, and whole grains, regular physical activity, avoiding smoking, and limiting alcohol intake. Managing stress and getting enough sleep are also crucial. These habits help reduce the risk of chronic diseases like hypertension, diabetes, and respiratory conditions.
Interesting.
Yeah, it's fascinating how much impact our daily choices can have on our long-term health. Any specific area?
When it comes to disease, what's the most common cause of disease then? Is it CVD? Is it cancer? Is it respiratory? In the UK, let's say.
As of 2025, dementia, especially Alzheimer's, is one of the leading causes of death in the UK, surpassing heart disease. This rise is tied to an aging population, and conditions like obesity and smoking also continue to impact public health.
Excuse me, guys. Interesting. So you mentioned a few things there. Okay. You mentioned obesity too. Okay. So, what about things like age and sex and family history and genes, stress, depression? Do these play a role too, I assume?
Absolutely. Age is a significant risk factor for many diseases. Family history and genetics can predispose someone to conditions like heart disease or cancer. Stress and mental health issues, such as depression, can also affect physical health, impacting everything from the immune system to heart health. It's all interconnected.
Okay. So things like diet to access to medical care.
Definitely. Diet plays a huge role in preventing and managing diseases. Access to medical care is crucial for early detection and treatment. Socioeconomic factors like income and education also influence these aspects, affecting overall health outcomes.
And interesting. Okay. So alcohol, TV, are these risk factors? Fruit and veg intake, red meats.
Yes, alcohol consumption, especially in excess, is a risk factor for various diseases. Watching a lot of TV often means less physical activity, which isn't great for health. On the flip side, eating plenty of fruits and veggies and moderating red meat are linked to better health outcomes.
Interesting.
It really is. Making small, positive changes in these areas can have a big impact over time.
And can you explain to us, when it comes to preventing, what does primary and secondary prevention mean?
Sure, primary prevention involves measures to prevent a disease from occurring in the first place, like vaccinations or healthy lifestyle choices. Secondary prevention aims to detect and treat a disease early, such as screenings for cancer or managing high blood pressure to prevent complications.
Interesting. So screenings, you said, or managing blood pressure.
Exactly. Screenings like mammograms or colonoscopies help catch diseases early. Managing blood pressure or cholesterol aims to prevent complications like heart attacks or strokes. Prevention is key. It's all about catching issues early or stopping them before they start.
Okay. Now, let me ask you. So, are rich people more likely to have CVD incidents, or less likely? What's going on?
It depends. Generally, higher socioeconomic status is linked to better access to healthcare and healthier lifestyles, which can reduce CVD risk. However, lifestyle factors like diet and exercise play a big role, so it's not a straightforward answer.
So it's basically, well, let's put it into perspective as CVD incidence and CVD mortality. Would you agree that very rich people have a higher incidence but also a higher mortality than the normal person, and also poor people have perhaps, yes, actually, scratch that. Maybe I'm wrong, but it seems to me like poor people and rich people have a CVD incidence that's higher, but rich people have a lower mortality?
You've got it partly right. Lower socioeconomic status often correlates with higher CVD incidence and mortality due to limited access to healthcare, healthy food, and other resources. Wealthier individuals might have more resources for prevention and treatment, potentially leading to lower mortality despite a higher incidence.
Mortality means death?
Exactly. Mortality refers to the rate of death in a population from a specific cause. So lower mortality means fewer deaths.
And also, another thing I wanted to ask is kind of our perception of health is different. We might believe we're more healthy than we are, or less healthy than we are. How is that across the socioeconomic status?
That's a great point. Perceptions of health can vary widely based on socioeconomic status. People with more resources might have better health literacy, but also higher expectations. Conversely, those with fewer resources might underestimate health issues due to limited access or awareness.
It seems that, so would you say that people underestimate diet and exercise, or?
Many people do underestimate the impact of diet and exercise. They might not realize how much these factors can influence their overall health, especially long term. Education and awareness can make a big difference in changing these perceptions.
Are you aware of the study Perkins-Porras et al. 2006?
Yes, the Whitehall 2 study is well known. It investigated how social determinants, like job status, affect health. It found that lower employment grades were linked to higher risks of poor health outcomes, highlighting the impact of social inequality on health.
And I don't know if we're talking about the same study, but in this study I've mentioned there was something about men being more likely to say that poor diet and hard work caused CVD, whereas women were more likely to say that it was chance or bad luck. And I wonder, what do you think the reasons for that is?
That might be influenced by social and cultural differences. Men might attribute CVD to lifestyle factors like diet and work stress, while women may perceive health outcomes as more influenced by luck or genetics. These perceptions can be shaped by personal experiences and societal norms.
Interesting. And what about can you explain us the iceberg analogy? I mean, I'm jumping fields now. I just want to talk a bit about kind of lifestyle and respiratory disease for a moment. So explain us the analog of the the analogy, sorry, of the iceberg analogy when it comes to the common cold.
Sure, the iceberg analogy in respiratory diseases, like the common cold, means that the cases we see are just the tip above the water. There are many more unreported or mild cases beneath the surface. This reflects that many people have mild or asymptomatic infections that don't get counted.
And the common cold is a problem, I understand.
It can be, especially because it's so widespread. While usually mild, it can cause complications for vulnerable people.
What about actually being exposed to cold? Does it cause a cold if your feet are exposed to cold or something?
Not directly. Colds are caused by viruses, but being exposed to cold weather can lower your immune response, making you more susceptible. So it's more about how your body reacts. Staying warm and taking care of yourself can help your immune system stay strong.
Interesting.
Yeah, it's fascinating how our bodies respond to different conditions.
So what is it? Is it like a vasoconstriction in the nose and upper airways which inhibits respiratory defense? What is it?
That's part of it. Cold exposure can cause vasoconstriction in the nose, which might reduce the effectiveness of your respiratory defenses. This can make it easier for viruses to take hold. Plus, spending more time indoors in close contact with others during cold weather can increase the spread of viruses.
Because there's not going to be a lot of immune cells going. What is the problem with vasoconstriction?
Vasoconstriction can limit blood flow, which means fewer immune cells reach the nasal passages. This can reduce your body's ability to fend off viruses, making it easier for infections to take hold.
Well, okay, interesting. What about sleep? In fact, you know what? Let's take it as tell us about sleep and then tell us about sleep in ADHD individuals. Do ADHD individuals need to sleep in a fixed schedule?
Sleep is crucial for overall health, including for ADHD individuals. They often have trouble with sleep due to irregular schedules or hyperactivity. Maintaining a consistent sleep schedule can help regulate their sleep patterns, improve focus, and manage symptoms.
The voice lagging a bit, isn't it, guys? Interesting. And what about something like vitamin C? Does it actually help with cold or not?
Vitamin C is often touted for boosting the immune system, but its effectiveness in preventing colds is debated. Some studies suggest that regular use might slightly reduce the duration or severity, but it's not a guaranteed cure. If you're already sick, it might offer a small benefit, but it's not a magic bullet.
Interesting.
Yeah, it's interesting how our bodies respond to different nutrients.
It seems we have mixed results. I'm looking at some scientific articles. We have mixed results in its effects on kind of cold incidence and duration.
Exactly. The evidence is mixed. While some people swear by vitamin C, others might not notice much difference. It's always good to look at multiple sources and find what works best for you.
Stress is a big one, I think. Stress increases the risk of a common cold.
Absolutely. Stress can weaken the immune system, making you more susceptible to colds. Managing stress with techniques like meditation, exercise, or even just good sleep can help keep you healthy.
And we already talked a bit about SES, socioeconomic status. And hand washing is an interesting one. I mean, could you explain this a bit to us? For instance, with hand washing in hospitals, it leads to a lot of really strong kind of bacteria being developed, right?
Yeah. Hand washing is crucial in hospitals to prevent infections, but over-reliance on certain disinfectants can contribute to antibiotic-resistant bacteria. That's why proper protocols and alternating disinfectants are essential to minimize resistance.
Interesting, the alternating disinfectants.
Yeah, rotating disinfectants helps reduce the risk of bacteria developing resistance. It's a bit like not letting bacteria get too comfortable with any one method. Hospitals have to stay on top of this to keep patients safe.
Asthma is an interesting one because it seems like asthma varies from person to person.
Absolutely. Asthma can vary a lot. Some people have mild symptoms, while others experience severe attacks. Triggers also differ, from allergens to exercise. So treatment and management plans need to be personalized.
Yeah.
Exactly. Personalization is key.
And stress with asthma is a dangerous combination, it seems too.
Definitely. Stress can be a significant trigger for asthma symptoms. Managing stress through relaxation techniques, exercise, or mindfulness can help reduce the frequency or severity of attacks.
What about acute stress as effects of asthma? Are they similar to chronic stress?
Acute stress can cause sudden asthma flare-ups, similar to chronic stress, but the impact might be more immediate. Both types of stress can narrow airways and increase inflammation, making breathing more difficult. So, managing stress is important for asthma control.
Interesting.
Yeah, it's fascinating how interconnected everything is.
And now, let's talk a bit more about the perception of kind of our illness. Is there a difference between the word illness and disease?
Yes, there's a difference. Illness is a more personal experience, how someone feels when they're unwell. Disease, on the other hand, refers to a specific medical condition or diagnosis. So, illness is subjective, while disease is more clinical.
Okay. So yeah, I was just going to ask, if I perceive my disease as something worse, is that going to affect me more?
It can. How we perceive our illness can influence our stress levels and overall well-being. A more negative perception might lead to increased anxiety or even worsen symptoms. So maintaining a positive outlook can actually support better health outcomes.
Interesting.
It really shows how powerful our minds can be.
Okay, and smoking is another big problem, I guess, with respiratory disease. Can we talk a bit about smoking cessation methods?
Sure, smoking cessation methods vary. Common approaches include nicotine replacement therapy, medications like varenicline, and behavioral support such as counseling. Combining methods often yields the best results. Quitting smoking can significantly improve respiratory health.
What about things such as bupropion? Explain us what this is.
Bupropion is a medication that helps with smoking cessation. It works by reducing cravings and withdrawal symptoms. Originally an antidepressant, it affects neurotransmitters in the brain to help manage the urge to smoke.
Dude, I used to like smoke sometimes when I was younger. I don't know how I feel about this thing of replacing it with something else, though.
I get that. It's a personal journey. Some people find replacement methods helpful, while others prefer different approaches. The key is finding what works best for you.
Interesting. Okay, let's go back to the heart a bit. So, can we talk a bit about causal illness attributions for heart failure, please? What do people underestimate, overestimate the impact of?
Sure, with heart failure, people often underestimate the impact of lifestyle factors like diet, exercise, and stress management. They might overestimate the role of genetics or assume medications alone can manage it. A balanced approach, addressing both medical and lifestyle factors, is crucial for effective management.
Interesting. And when it comes to something like a myocardial infarction, What factors are linked to shorter time to getting to hospital?
For a myocardial infarction or heart attack, quicker hospital arrival is linked to factors like recognizing symptoms early, living close to medical facilities, and having someone to call emergency services. Public awareness and education about heart attack signs also play a big role.
What about sex or being married?
Yeah, factors like gender and marital status can influence response times. Studies suggest men often arrive at hospitals faster than women, possibly due to differences in symptom recognition. Being married might help because spouses can encourage quick action.
Interesting. So, okay. We talked about stress too. What about sorry guys. What about emotional stuff? Like if you have PTSD, I assume that makes things worse or no? And if yes, then why?
Absolutely. Emotional factors like PTSD can definitely exacerbate stress. PTSD involves heightened anxiety, which can put your body in a constant state of fight or flight. This stress response releases hormones like cortisol, which can worsen symptoms. So, yes, PTSD can make stress harder to manage because your body's already on high alert.
Interesting. Okay, and let me ask you one more thing before we finish. If you had to give one piece of advice to people to take care of their lifestyle if they can, because this is the thing with lifestyle, we're assuming that we're talking to people that are not in a war zone, that have time to sleep, that have food, that have a home. What would you give?
That's a great point. Lifestyle advice has to be realistic. I'd say focusing on small, sustainable changes is key. Even if it's just finding 5 minutes a day for something that brings joy or calm, it can make a difference. Balance, not perfection, should be the goal.
Booyakasha. Okay, thank you for listening, guys. Sorry for the small episode today. I'm sorry that I'm tired. Let's make sure I do it at 4 p.m. like I usually do next time, and see you later.